So, so today is Wednesday, March 19th, 2024. I'm going to continue to read from where I left off last night. So I have about 10 to 15 minutes to go before I hit the road with my car to go to work, to commute to my workplace. How to treat clenching and grinding. Studies have acknowledged that treating daytime bruxism is challenging due to increased levels of anxiety and somatic symptoms reported in these patients. Somatic symptoms, I've read this one before, right? Somatic symptoms refer to psychological distress of some kind expressing itself as physical symptoms in the body. Despite the absence of physical cause, somatic symptoms such as pain, nausea, and clenching are real and not falsely purported. Most people will experience somatic symptoms at some point. For example, a nervous public speaker may feel nauseous and even vomit from the fear of speaking in front of a large audience. Few high-quality studies have been conducted to evaluate treatments directed at clenching or grinding during the day. Without evidence-based treatments for daytime bruxism, only general suggestions can be made cautiously, which are listed below. There have been several randomized control trials evaluating the treatment of sleep bruxism. Evidence supporting the treatments is mentioned where available. Good sleep hygiene. Treating clenching and grinding at night often begins with practicing good sleep hygiene. This includes restricting caffeine, smoking, and drinking alcohol at night, limiting physical and mental activity before going to bed, and ensuring optimal sleeping conditions in the bedroom can also assist. The bedroom should be dark and quiet. A TV and other stimulating electronic devices in the bedroom can be detrimental to sleep quality. One randomized controlled trial evaluated the effect of 4 weeks of sleep hygiene with relaxation techniques for sleep bruxism, but failed to find significant changes. Despite this result, practicing good sleep hygiene is a good idea. Alcohol, tobacco, and coffee consumption before bed are known risk factors for sleep clenching or grinding. Sensitivity to stress is also commonly reported in patients. 2. Mouth guard, also known as a night guard. Okay, so night guard, mouth guard, or occlusal splint. These devices are considered to be the first line of defense for preventing further tooth wear and grinding noises at night. Night guard, mouth guard, and occlusal splint. A mouth guard is one of the best treatments available to help relieve the strain from strenuous jaw clenching and grinding. It helps prevent sore jaw muscles and joints. It helps prevent sore jaw muscles and joints. Custom mouth guards that are molded to a person's bite are a more comfortable and effective option. Non-custom, store-bought night guards can be uncomfortable or even painful to use. In addition, non-custom night guards can exacerbate occlusal issues and cause shifting of the teeth within the gums, which can lead to gaps forming between teeth. It tends to improve the severity of clenching, but may not have any lasting effects on reducing the frequency of clenching throughout the night. In rare cases, occlusal splints may interfere with breathing airways during sleep in those with obstructive sleep apnea OSA. If you have OSA, then special care is required when the splint is devised. Those with OSA may benefit from a mandibular advancement device which can help with both OSA and bruxism. 3. Mandibular advancement devices. These devices are typically used for the management of sleep apnea and snoring. Like the night guard, these devices are inserted into the mouth at night to wear whilst sleeping. The mandibular advancement device brings forward or advances the lower jaw mandible by around 8 to 10 millimeters. This helps keep the airways open. The Bruxism Association of the UK indicates that these devices have often shown more positive results for bruxism, but with the cost of some discomfort whilst wearing the device. While, right? Americans use while, British uses whilst. 4. Stress management. Two commonly suggested techniques for stress management are cognitive behavioral therapy, CBT, and biofeedback. Whilst these have been reported as helpful for stress management, initial studies of CBT and biofeedback for bruxism did not correlate with any improvements on their own. CBT and biofeedback tend to be most effective when done in combination with other strategies to reduce the frequency and severity of bruxism. 5. Regular exercise. Exercise have been proven to help better manage stress. It releases endorphins. It can deliver minor aches. It can relieve minor aches and pains. And it provides a sense of well-being. This may assist those with bruxism. So here, the aches and pains are plural, right? It can relieve minor aches and pains. 6. Behavioral therapy. Bruxism, particularly daytime bruxism, is a habit that we can slip into subconsciously over time. By the time we become aware of it, we may have already become deeply rooted in this behavior. Behavioral modification and habit reversal may offer helpful techniques to break the stubborn habit. In more difficult cases, psychological counseling can be helpful. 7. Botox. Recent studies have reviewed Botox as a treatment option for bruxism. Results indicated that the force and the strength of activity, right? Strength and activity are reduced were reduced significantly, but no change in frequency was found. In addition, it is expected that as the effect wears off from Botox around the 12-week point, so roughly it lasts 3 months, right? The force of clenching and grinding return. It is expected that as the effect wears off from Botox around the 12th week point, the force of the clenching and grinding return. Here, return is just a root word because we have the word expect. 8. Electrical stimulation. Like Botox, electrical stimulation has been trialed with bruxism. Results from 2 experimental studies found a reduction in the frequency of bruxism during sleep, but with no change in pain or muscle tension. This suggests that whilst the frequency is reduced, the severity and force of clenching and grinding is not. Another study confirmed this result, as well as finding that the benefits were realized only whilst the device was being used. Results did not continue after the device was stopped. Hypnosis. 9. Hypnosis. This is one alternative approach which has been triggered by some dental organizations, although it lacks clinical evidence. Right? It lacks clinical evidence. Physical therapy. 10. Physical therapy may be used to relieve some of the tension and stiffness caused by excessive use of the jaw muscles. 11. Meditation. These and other relaxation techniques can produce a greater sense of self-esteem, help manage anxiety, stress, and control over one's body. There is no strong evidence in the literature regarding its efficacy. Its use may be more beneficial to those with stress or anxiety-related causes. B-complex vitamins. Deficiency in B vitamins can lead to psychological stress, depression, and anxiety. The efficacy of B complex has been demonstrated in overall health and wellness. Beginning the day in a balanced state of mind sets you up for success. Valerian root. This supplement has been used for centuries as a natural sedative. It has anti-anxiety properties and has been shown to improve quality of sleep without side effects. Since bruxism is considered a sleep-related movement disorder, valerian root may be beneficial. There is weak evidence from studies supporting the above medications and vitamins. There is weak evidence, right? Not strong evidence, weak evidence. They may be helpful, but randomized clinical trials are required to establish their true efficacy in treating bruxism. Without these studies, only tentative suggestions can be made based on hypotheses. So valerian root, sedative, bruxism, weak evidence. Conclusion. This article was written because clenching has become one of the most significant contributors to my own migraine condition. I've had countless headaches and several migraine attacks from clenching during the day, and probably more that I am not aware of from the night before. I am disappointed to say that there's no single successful treatment that addresses the root cause of clenching or grinding. Therefore, the first clinical focus of bruxism is often to prevent further dental wear, grinding noise, and relieve any muscular and joint discomforts or dysfunction. One of the best ways to do this and protect your teeth is with a custom-made night guard, occlusal splint of some kind. This also helps relieve the extreme pressure on your teeth, as well as the fatigue and soreness in your muscles and joints. I have found it very helpful. With the urgent symptoms covered, you can then begin working on the root cause. The best treatment strategy will be those which best address your potential causes. The best results can often occur with combination therapies, adding different modalities as needed if a night guard alone doesn't deliver. Adding different modalities. For example, incorporating lifestyle changes, a night guard, supplements, and medication or Botox. Could be due to a sleep disorder, stress, anxiety, or lifestyle factors, or all of the above. I'm still working it out personally and combining complementary strategies. Are you aware of clenching or grinding? I would love to hear from you in the comments. Thanks for listening. I have to go to work. I just parked my car, so I'm going to work now. Bye-bye.